dear friends, medicine without drugs. These two picture on my first slide should make you think that yes, they are not same. How come this picture has come with medicine and how this drugs and how they are different? We'll come to know very shortly. Friends, we are now in the age of pandemic. 2021, 22 strangled us to this one of the worst pandemics in 21st century. अभी फिर से आ रहा, फिर से कोविड का जो मेनेस है, जो उसका डर है, उसका जो लोगों को अफेक्ट कर रहा है, वो फिर से शुरू हो गया है कोविड। दोस्तों, वन ऑफ द फाइनेस्ट उर्दू एंड हिंदी पोएट मिर्जा गालिब, who actually was a resident of our capital, New Delhi. He took birth in late 18th century, 1797, and lived for around 71 years. So during his life, during his period of stay in Chandni Chowk, Delhi, on one of the days, he was just about to go out to the market from his house. He was about to start. His wife said, "No, no, मत जाइए, मत जाइए स्वामी, बाहर मत जाइए। क्यों? क्यों नहीं जाऊं? ना, बाहर महामारी फैली हुई है." And Mirza Ghalib immediately had this thought in his mind, and he penned it down very aptly. रहिए अब ऐसी जगह चलकर जहां कोई ना हो, हम सुखन कोई न हो, और हम जवां कोई न हो। पड़िए घर बीमार तो न हो तीमारदार, और अगर मर जाइए तो नौहा वहां कोई न हो। कि अभी हमको ऐसी जगह चलकर रहना पड़ेगा जहां कोई अपना नहीं होगा, अकेले रहना पड़ेगा। किसी से हम बात नहीं कर सकते हैं, हम जवां कोई ना हो, किसी से गपशप नहीं कर सकते हैं, किसी से चैट नहीं कर सकते हैं, सुख दुख का हाल नहीं कर सकते हैं। पड़िए अगर बीमार तो कोई ना हो तीमारदार, कोई पूछने वाला ना हो, और अगर मर जाइए तो नोहा ख्वां, रोने वाला नोहा ख्वां कोई ना हो। तो ये जो कोविड की महामारी थी दोस्तों, 21, 22 और अभी फिर से आ रही है, ऐसा ही हाल था कुछ हम सभी का। कहीं जाना नहीं है, किसी से मिलना नहीं है, घर में दुबक के रहना है, काम नहीं है, कहीं ऑफिस नहीं जाना, काम को नहीं जाना, स्कूल बंद, सारे चीज बंद। तो ये महामारी का जो चित्रण किया था मिर्जा गालिब ने, बिल्कुल सही बैठता है। इसमें वो बोल रहे हैं कि मेडिसिन की जरूरत नहीं है महामारी में। महामारी जितनी भी हुई है आज तक दोस्तों, सबसे बड़ी महामारी ये हुई थी 14वीं शताब्दी में, 1347 टू 1351, 4 साल, ब्यूबोनिक प्लेग की। इसमें 20 करोड़ पृथ्वीवासी ने उनके जान गंवा दी। और ये 20वीं सदी की जो महामारी है, स्पेनिश फ्लू, सबसे ये 100 साल का सबसे बड़ा महामारी स्पेनिश फ्लू, 1918 टू 1919, फर्स्ट वर्ल्ड वॉर के समय में ये 2 साल चली। उसमें 4 से 5 करोड़ लोगों ने अपनी जान दी, 40 to 50 मिलियन। उसके सामने ये कोविड महामारी कुछ भी नहीं है। कुछ लाख लोगों ने अपनी जान गंवाई है, तब 4 से 5 करोड़ लोगों ने अपनी जान गंवाई थी 18 टू 19 फ्लू पैंडेमिक, स्पेनिश फ्लू में। 50 करोड़ पृथ्वीवासी उससे अफेक्टेड हुए थे, और 5 करोड़ ने अपनी जान गंवाई थी। तब दोस्तों क्या था? कोई एंटीबायोटिक थी, कोई वैक्सीन निकला, कोई वेंटिलेटर्स थे, एंड देयर वाज नो कम्युनिकेशन। कोई हवाई जहाज, रोड, कुछ नहीं। लेकिन दोस्तों, ये महामारी कंट्रोल में आई या नहीं? कोई मेडिसिन उतने एडवांस नहीं थे, मेडिसिन, मेडिकल साइंस, कुछ आईसीयू नहीं थे, वेंटिलेटर्स नहीं थे, तो कंट्रोल में आई कि नहीं दोस्तों? कैसे आई? आइसोलेशन, क्वारंटाइन, गुड पर्सनल हाइजीन, डिसइंफेक्टेंट्स, लिमिटेशंस ऑफ पब्लिक गैदरिंग, ये पांच जो है यो आज भी उतनी ही उनकी जरूरत है जितनी 100 साल पहले थी, जितनी 400 साल पहले थी दोस्तों। इसमें कहीं कुछ मेडिसिन या ड्रग्स, जिसको हम सोचते हैं कि ड्रग जो है मेडिसिन है, कोई ड्रग का यूज नहीं है ये पांचों में। तब भी वो महामारी, इतनी बड़ी भयंकर महामारी 100 साल की, कंट्रोल में आई दोस्त। चांदनी चौक बहुत ही पॉपुलेटेड एरिया है अपने राजधानी का। इट्स अ वेरी हाईली पॉपुलेटेड ओल्ड दिल्ली। The government, all the NGOs, medical fraternity, they propagated on the start of COVID pandemic की isolation, quarantine, घर में रहो, एकदम जरूरी न हो तो you don't go out of your house, don't come out. People didn't listen. So the government, the state government in Delhi, present government, what it did, in चांदनी चौक there are 105 bylanes, गलियां हैं। तो in all the lanes of entry and exit, the government put up this line from one of the finest lyricist and poet and philosopher of our time, गुलजार साहब। उन्होंने क्या किया, क्या कहा था? बिना वजह घर से निकलने की जरूरत क्या है, मौत से आंख मिलाने की जरूरत क्या है, सबको मालूम है बाहर की हवा कातिल है, यूं ही कातिल से उलझने की जरूरत क्या है। एंड द स्टेट गवर्नमेंट पुट अप बैनर्स with these four lines of Guljar Shah on all the bylines of entry and exit. The crowding, the people coming out of house immediately stopped. They realized how for no sake, without emergency, coming out is a really deadly venture. So, friends, drugs, they were not in use. They were not advocated as this social. I don't like this word social distancing. I like physical distancing, because social distancing is not appropriate. There should be a physical distancing. We are all social animals. We cannot become antisocial or non-social. So there should be physical distancing, masking, and sanitization. And drugs are not in play. They were never advocated like these three were hugely advocated in last 4 years. So, dear friends, medicine, as we must know, is though a study of science, is a practice of arts. It is not all about drugs. Arts and the practice and the thought must be inculcated in our habit, in the study of science. Medicine again, though we are devotees, we are disciples of science, but we must be romancing arts. We are all proponents of medicine, we are practitioners. Most of the delegates who have joined today, many of them are medical professionals. But dear friends, we must know that even though we are committed to science, we should be romancing arts in our practice. Then only we will be able to do a really good job. What is medicine? Now we'll come to the literary meaning of medicine. From Wikipedia, I have taken it In Latin, medicina, that is the word from which medicine word has come up. And what is the meaning? The art of healing or the means of healing. So art is there in this science. We cannot keep out art from this science, medical science. It means healing. It is again from medicinus, another Greek word relating to healing. Again, it come out from medior or medicor. That also means to heal or cure in Egyptian language. So there is no mention of any drug. Medicine means healing. Medicine is the science and practice of caring for a patient, managing the diagnosis, prognosis, prevention, treatment, palliation of their injury or disease, and promoting their health, not curing the disease, promoting their health. That is the exact meaning of medicine. And what is drug? Drug, taken from French word draw, which means dry herb. Any substance other than food that is used to prevent, diagnose, treat, or relieve symptoms of a disease or abnormal condition. They are called drugs. A drug is a chemical substance. Medicine is not chemical. It is about healing. It is not about curing. A drug is any chemical substance that causes a change in an organism's, a life's physiology or psychology when consumed, when taken. So, dear friends, now there should be a little bit of clarity that how different they are, medicine and drugs. Every time, lot of time in our daily life, we have talked about drug reactions, drug toxicity, the harm that any particular compound has caused. But we never use medicine reaction. We use the phrase drug reaction. So there lies the real essence of medicine and drug. Medicine doesn't cause reaction. Medicine is about healing. Medicine about holistic thing, whereas drug is a compound, is a chemical. It can cause reaction. It can cause side effect. There can be intolerance to that particular compound. Nowadays, dear friends, many medical schools now they propagate. They have art programs through which they teach students observational skills and better bedside manners. We will see how they are so important to promote healing, to promote health, to practice medicine in the best possible way. Unless we have these observational skills and better bedside manners, we medical professionals are no use, are of no use. We are no good. Nowadays, dear friends, unlike artists, doctors have lost the skill of observation. One of my great teachers, he once told me, Narayan, if you want to be a good doctor, go and read these investigative stories about James Bond. Go read those books because there lies the great this skill of developing observation skills. Expensive tests are available nowadays. That has taken all of us medical professionals away from practicing medicine in its real sense. Necessity of observation decreasing day by day. Skill is disappearing fast, like a water bubble. Less and less time on speaking, listening, and touching a patient. We don't spend time. We don't have time. We are overcrowded with patients, and moreover, we don't have that intentions also. More time and money is spent on doing tests, which are mostly avoidable because of our vested interest, monetary gains, materialistic comfort, And drugs, which we can always adjust, we can always bring down. But we go on a spree of writing drugs, plentiful of drugs in our prescription. Skills of medicine, there are majorly five in my opinion. Observation, that is the most important skill one can ever have. Any medical professional would do well to develop this skill. Size, shape, color, the change, everything that we are should be keen to observe, because that is very, very important to have a good holistic view of a particular individual or condition. Active listening, we will talk about what is listening, what is active listening, how different they are. That is very essential. Touch. We should be touching lives, not diseases. Then only we will practice medicine and its real sense. Problem solving after observation, listening properly, actively, and touching the live, examining, then there should be synthesis in our brain. We should be able to solve the problem and bring out the best possible solution. But nothing will work except without us developing a little bit of empathy, an iota of empathy towards a particular life. Professor Dr. Gopal Chandra Das, our first pediatric MD medicine of our state, Odisha, one of the towering personality, and he was known for his observational skill. I didn't have the privilege to be a student of him, but I have had the privilege of his having his unconditional love and blessings. So he was known to diagnose any medical condition from a kilometer, from a mile, from a distance. He was one of the finest proponent of observational skills, getting into the medical science and taking care of the patient, the child, the disease in appropriateness. Another one of my favorite teacher, Dr. Pitavasasa. His vision was TL, till light. He was able to see, almost blind. He used to walk by his senses. He used to come in a two-wheeler only by his feeling, his sense of the lane, by-lane road. He would come from his house to hospital. And one of the finest proponent of listening, active listening. He couldn't see properly, but only standing beside the parents, beside the child's bed, he would only listen. He would ask and he would listen. And there lies the huge importance of active listening. Listen, be all ears to the child and parents, then think, and then synthesize and speak again, and again listen. So this is called active listening. Listening, thinking, then again putting queries, asking, speaking, then again listening. So this triad is active listening. And nobody, I have seen none better practitioner than my great teacher, Dr. Pitos. So was there any use of any drug, any medicine, any compound, any chemical? So, dear friends, we have heard this term, Seba Susrusa. So, we are in Seba, we are in medicine, we are medical professionals, many of us, even non-medical professionals. Seba can be done by anyone. As our father Mahatma Gandhi said, Seva is not private to only medicine. But why this Seva Susrusa? What is Susrusa? That is, su, अच्छा से, Susa, sunna, to listen well, deeply, meaningfully. That they then only will be able to impart Saba to anyone. Unless we listen intently, deeply, meaningfully, we will not be able to impart Seba to it. So that is, and the finest proponent is Dr. Pitavasa Saab. Hug. Now nothing will work, my dear friends, better than a hug, a real warm hug. Start, medical professionals, dear friends, you start doing this from today and you know what a magic it is. My teacher, both of them, they are my teacher, Dr. Sarajanandan Parida and Dr. Lingaraj Pradhan. Any child walking into the clinic, the first thing that they do, they would hug. Any friend, any student, anyone meeting them socially, they would hug. They would just embrace and they would, with all their love and warmth, they would just embrace that life. And that is healing. That is medicine. Works like magic. They have taught me how to hug each and every life. Touch. Another teacher, Dr. Mohini Mohan Das. My dear friends, the way he touched kids, little gods, small lives. My eyes are privy and thousands of his students, their witness. Not even a mother would be able to touch with so much of love and kindness his baby. With such love, unconditional, such softness. वो जैसे बाल संवारते थे बच्चों का बेड में, कोई माँ अपने बच्चे का कभी बाल नहीं संवारी हो. वो जैसे बंद किया हुआ शर्ट को खोलेंगे, बटन फिर लगाएंगे, फिर खोलेंगे, विथ सच लव. कोई माँ कभी अपने बच्चों का बटन नहीं लगाया उसके शर्ट्स. My dear friends, my teacher taught me how to touch and how touching would open a floodgate of real healing. Empathy, another greatest proponent, Professor P. Subarna Devi, she would just put hands, she would just put hand on shoulder, the head of a student, of a junior, of any child in the world, any patient, and she would listen and the problem would be gone. So that is empathy. She would just be involved. She would just feel that what the other life is feeling, what is going on his or her mind. So that is enough. That is done. And the result starts showing. So this is P. Subarna Devi propagating, practicing empathy in the purest form. So, dear friends, these are the four words I love to talk about: apathy, antipathy, sympathy. But empathy is supreme. This is spiritual. This is just next to God. इतना करीब भगवान के और कुछ नहीं. Empathy, sitting. We can never practice empathy standing. Like sympathy, we can practice sympathy standing there, but empathy, we have to see. We have to just put ourselves into the position, life of another one. Then only the real feel, the real empathy will come. So that is empathy. We medical professionals, we can never do without empathy. So, dear friends, what Hippocrates told, finest philosopher, greatest proponent of medicine, as to diseases, make a habit of two things: to help or at least to do no harm. So first do no harm, then try to do good. Non-maleficence should be first, no harm, then do good beneficence. And we can never do this without having an ounce of empathy in our heart. Hippocrates again has told, it's far more important to know what person the disease has. वो जो बीमारी है उसको कौन है rather than जो इंसान है उसको क्या बीमारी है. तो टू अंडरस्टैंड द पर्सन, that is more important to understand the disease. Understanding a person is always important. Then only we will be able to do justice to that particular situation, condition, medical condition, disease, whatever. So understanding person, that is medicine, that is healing, that is holistic, that is without any side effect, toxicity, intolerance. Dr. Stone Crosser, a great psychologist from USA, his book, Hug Therapy, my dear friends, please take a tour of this book, Hug Therapy. He was called the Hug Doctor. He was the first to propagate hug as a medicine. Then Dr. Love, he was called Dr. Love. Who he was? Leo Boscaglia. He was not a doctor, not medical professional. He was an author, a philosopher, a lifestyle coach, motivational speaker. What he told, too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest accomplishment, or the smallest act of caring, all of which have the potential to turn a life around. Dear friends, कहीं कोई ड्रग का मेंशन नहीं, कोई केमिकल, कोई कंपाउंड नहीं चाहिए. He was the first to state and promote the concept of humanity's need for hugs. What he told, at least 5 hugs per day are needed to survive. 8 hugs per day to maintain oneself. And 12 hugs per day are essential to thrive, to do well, to prosper, to progress. So very essential this role of hug in our life, in our health, in medicine. This is WhatsApp GAN, but this is real GAN that I thought to put up here. A wise physician once said, the best medicine for humans is love. कोई ड्रग का काम ही नहीं है. Someone asked, what if it doesn't work? Then he smiled back and answered, increase the dose. ना DS होता है ना, double strength. So multiply the dose. Multiply love. Healing will start. Sir William Osler, a great medical professional, doctor, and whatnot. And in medicine, maximum science, this names, nomenclature has been awarded to Dr. Sir William Osler, more than 1,000, whatever I have gathered from Wikipedia. The good, what he said, the good physician treats the disease, but the great physician treats the person who has the disease. It's very minimal, nominal to treat a disease, but it is really good, really great to treat the person, whole being, not a particular organ or disease. But my dear friends, I beg forgiveness to add to Sir William Osler. So what are my thoughts? And the greatest one Great one is person who has the disease, but the greatest one, these are my thoughts, treats the disease, the person, and the environment surrounding, both living and non-living. कोई बच्चा अगर आया कोई मेडिकल प्रॉब्लम से, खांसी से, बुखार से, टाइफाइड से, निमोनिया से, निमोनिया ठीक करना है, बच्चों को पूरा देखना है, एंड सबसे अच्छा क्या होगा, बच्चों के पेरेंट्स, उसके फैमिली मेंबर्स, द सराउंडिंग, उसका लिविंग कंडीशन, द एनवायरनमेंट, द हैबिटेट. If I get into that, I take care of those things, then I'll be doing a real good job. And that is real medicine, my dear friends. So, what are the magnificent seven, in my opinion, in medical science? Take a moment, small, all seven are very, very small things. Take a moment to focus before consultation. थोड़ा समय लीजिए. Establish a small rapport and agree on an agenda. And assess minutely, बारीकी से, the patient's response to illness and suffering. Communicate softly to foster healing. हीलिंग बिना सॉफ्ट बात किए हीलिंग नहीं आए. जोर बात करेंगे, चिल्लाएंगे, ज्यादा स्कार्स हो, ज्यादा अल्सर्स हो. यूज द पावर ऑफ टेंडर टच. देयर कैन नेवर बी ए बेटर हीलर देन ए टेंडर टच. स्माइल ए लिटिल. दैट इज अगेन ए ग्रेट हीलर. पक्का रिटर्न मिलेगा कोई भी स्माइल का, विथ इंटरेस्ट, कंपाउंड इंटरेस्ट, इमीडिएटली, देन एंड देयर. And we human beings, we are the only one who can smile in this earth, in this universe. Show some empathy. So, my dear friends, only if we practice these seven things in small, little, minute, tenderly, then the real medicine will come in, will start flourishing. Now, yoga. And in last one decade, yoga, the practice, the propagation, the awareness has gone by leaps and bounds. So John Hopkins Institute, the finest, the best medical institute in the world from USA, they have said, क्योंकि अपन खुद के बात, अपनों का बात नहीं सुनते हैं. हजारों साल से योग का प्रणेता है अपना देश. इट स्टार्टेड फ्रॉम आवर कंट्री, आवर forefathers, rishi many, they practice hands, they started yoga, originated from our country. But how yoga can benefit? Improve strength, balance, flexibility. It helps back pain, chronic pain relief, arthritis symptoms. Heart health is best taken care of by yoga. It relaxes, helps us sleep better. We can have more energy, brighter moods, helps managing stress, because now we are living in sea of stress every day. This modern life, past life, yoga improves lung capacity, asthma outcomes. I am a practitioner of allergy asthma, and I know how a little bit of yoga, some pranayam every day regularly, go a long, long way to manage to make the child parents feel better. So these are no drug there, without drug. But this is real medicine, my dear friends. And lots of researches. Yes, for long, the modern research was not happening in yoga, but now in last decade, thousands and thousands of studies, publications, researches, they are happening in yoga. My dear friends. Ayurveda, again, started from our country, proud country. So it manages chronic problem wonderfully well. We just need to have our faith and lot of research, real research happening. Then only, because now is the age of evidence-based medicine. Never it is told that evidence-based drug. So please don't confuse medicine with drug, my dear friends. So Ayurveda. And Neti Kriya, I am practicing allergic rhinitis and asthma, and I know how the children, adolescents, and adults, when they practice Neti, Jal Neti every day, how wonderfully they become better with their allergies in upper airway and lower airway. So, infertility, there's chronic skin conditions, hair problems, chronic diseases, arthritis, they all can be taken care of really well. But what happens, my dear friends? These integrative, alternative medicines, the practitioners are very few. The real practitioner, real proponent who actually know the science, the practitioners are very, very less. That is why we fall in the wrong hands. But the science is not um, useless. It is of great use in promoting healing. Magnet therapy, another thing. The chronic conditions, paralysis, the arthritis, back pain. So all these can be taken care of, and a lot of research and publications studies are happening, evidences are gathering by every passing day. Another is acupuncture, again same chronic conditions, paralysis, pain, burning, some alternate sensations, all they can be taken care of by this alternative medicine, acupuncture, and a lot of research is happening on acupuncture in Western country, my dear friends, especially in America. So evidence, they are all PubMed index journals. So publications are coming out every day, and we should do well to actually embrace. We should not be exclusive. We should be inclusive because now is the age of integrative medicine. Or this allopathy medicine, modern medicine takes care of acute conditions well. But to manage chronic conditions, we will have to fall on this alternative therapy, my dear friends. So, dear friends, what are the take homes today for all of us? Medicine and drugs, they are like chalk and cheese. They are not same. They are as similar as a chalk and cheese. They are completely different, my dear friends. Medicine harmonizes, heals, and is holistic. Love, kindness, and empathy, in my opinion, my dear friends, they should be the first three drugs. Whether you call them drugs or medicine, I don't mind. But these three, they are without side effect, intolerance, or toxicity, and they are essential to any holistic health, spiritual health, overall well being, my dear friends. One of the greatest modern philosopher, Yuval Noah Harari. His books, they are bestsellers, Sapiens and all, going through the history of humankind. What he said, organisms really just algorithms, my dear friends. Is life really just data processing, a machine, a calculator, a computer? What is valued? Intelligence or consciousness? Which one is more important to have? What will happen to society, politics, and daily life when non conscious but highly intelligent algorithms know us better than we know ourselves? So, dear friends, we must know ourselves. We must understand life. We must have consciousness, chetana. Intelligence is secondary. Unless we have chetana, unless we have love, unless we have kindness, unless we have empathy, no medicine, no healing, nothing will happen, my dear friends, and we will be in the sea of drugs. Thank you, my dear friends. Thank you for this opportunity and your passionate